We're just letting people, we're just going to give people a few minutes, like a minute or so, just to get logged in and get their audio right. And then we'll get started very, very quickly. And again, thank you for joining us. And of course, I know we have a lot of us that are looking forward to the recording and using this as a resource later on. Of course, excited to share this webinar with you guys. I met Beth personally at SoSort a couple years ago in Boston, and I've had patients working with her and have had great experiences. So I'm excited to share this resource with us because, of course, as we're dealing with patients and especially adult patients, they can definitely benefit. Beth is a certified physical therapist and certified strength conditioning coach. She has scoliosis, a moderate scoliosis in the thoracic spine and lumbar spine, and she's turned this scoliosis journey really as a source of empowerment to really help other people, like a lot of us. And we all have had our own healthcare problems. That's why we become chiropractors. She's earned her doctor of physical therapy from Honey Hunter College and is an orthopedic clinical specialist. She's also trained in the Barcelona Schroth method, an SOL Schroth method, and as scoliosis exercise approach for scoliosis Cs. A lot of us have that training as well. Enhancing her focus on scoliosis and kyphosis, she has her own company called Strength and Spine, where they offer a lot of virtual training, which is good, really good for patients because they can do it from home. They don't have to go anywhere. They don't feel, they don't feel like this, competitive. They don't have that awkwardness. They're just doing it in the comfort of their own home. And she specializes in online personal training with scoliosis, spinal fusion, other spinal conditions, really kind of blending the rehab aspect of scoliosis with fitness and strength and self-confidence. So I'd like to introduce Beth, and she likes to be called Beth. Like we like to be called by our first name. So introduce her, and welcome, and the floor is yours.
Thank you so much, Tony, for having me. I'm really excited to share with you a little bit about resistance training for clients with scoliosis and how we are helping those clients. So I'm going to just get set up in terms of my screen. So give me one moment there, get this ready so then we can have my presentation.
Yeah, Beth, while you're doing that, I forgot to mention is that if you have questions, please write them down, keep them in your mind, because at the end we're going to turn it over for Q&A, and Heather will moderate the Q&A, so she will unmute the lines, allow you guys to ask the question, and then of course you remute your line, and then Beth will answer it for you. So hold on to your questions if you got them, and I'm sure she'll gladly answer them. I forgot to mention that, so go ahead, Beth.
Okay. All right, great. Yep, absolutely. Happy to answer any questions that people have. So I think you're good. You should be seeing my presentation there and hear me well. So let me see. I can do this. Yes. Okay. So a little background on me. Thank you, Tony, for the introduction. But I am Beth, and I am also diagnosed with scoliosis myself. So I was diagnosed as a teenager and I didn't have any treatment. Basically, I was diagnosed with a 10-degree curve. I was given a wait and see prescription, and then I came back and I had already grown to this 30-degree curve in my thoracic, but I was finished growing. So basically, it was goodbye, good luck, and go on your way. So for me, I just really didn't think anything of my scoliosis. And I was active track and field and things in high school. And I actually went on to compete in the sport of weightlifting. So I was introduced to weightlifting in 2005, and I started literally from lifting a broomstick all the way to squatting double my body weight, and putting 1.5 times my body weight overhead. So I did this for many years. I still do compete, but I ran into things with my scoliosis that I didn't realize were scoliosis issues. So that's kind of what inspired me to learn more. So I became a physical therapist in 2015, and then in 2018 I took my first training, which was the Barcelona Schroth method. And since then I've taken many different schools of scoliosis exercise training and kind of integrated that into my approach. In 2020, we launched the Scoliosis Strength Program. Well, I launched. It was just me at that time. And this was the first online coaching program for people with scoliosis. So I incorporate scoliosis specific exercise with strength training to help people with scoliosis, spinal fusion, to be able to enter fitness. Because the big challenge I was running into with my patients was that they were doing really well with their scoliosis exercises, but they wanted to go to the gym. They wanted to exercise like the typical person, and they didn't have access to that. So that's why I started Strength and Spine. And of course, we started it online because it was the pandemic, but we found that it worked really well having it online. We've seen some really great results. And we've learned a lot about the benefits of resistance training for people with scoliosis. So I'm excited to share with you a little bit about why I think resistance training is important for people with scoliosis and some tips to kind of get started and introduction into kind of how we work with people and to go from there. So the first thing is, why is resistance training important for people with scoliosis? So there's some research to tell us that, and probably you already know this, that people with scoliosis have higher injury risk. They may have reduced quality of life, and they may actually underreport their pain levels. They perceive their health worse than those with other comorbidities like hypertension, sciatica, and also knowing that decrease in a trunk muscle mass is a risk factor for development of degenerative scoliosis types, which I don't know if in your practice I'm seeing much more of these coming up in terms of adult scoliosis. But the nice thing is that strength training has a lot of benefits that can address these issues. So, improving strength has research to reduce injury risk, as well as to reduce anxiety, pain, reduce depression, fatigue, improve quality of life. So, there's many benefits from strength training that our clients with scoliosis want to have access to, but may be avoiding or afraid to because of their curve. And we know that if our clients don't maintain their strength, then they become more deconditioned. So they start to lose muscle mass potentially around the spine. They may lose bone mass. They may have some of that asymmetrical degeneration. And we know that sarcopenia and osteoporosis are risk factors for scoliosis progression. So this is something that we really want to stay on top of with our clients. And there's not a ton of resistance training for adults with scoliosis. There are case studies of powerlifter with scoliosis. A lot of the research is focused on the adolescent population, as you know, and generally we encourage sports for our adolescent population, and weight training does fall into the category of sport. Um, but really, the studies are just looking at muscle activation and things like that with resistance training. So we don't have a ton out there yet. Hoping to publish a case study probably within the next few years of some of our clients, a case series. We'll see how that goes. So many people with scoliosis abandon resistance training. They might be told by someone, a practitioner, that lifting weights with scoliosis is unsafe. They might get conflicting information online or from support groups. They start an exercise program that's too fast paced and they might have more issues. And they start to end up in this cascade where they do exercises, they end up with more pain or more soreness of their muscles, and they're not sure that they're doing the right thing. So then they stop. And they kind of end up in this repeating process over and over. So they try to exercise, they injure themselves, or they're worried about hurting themselves, and then they stop. So getting them kind of out of this repeated cycle is something really important. The other thing that I see is that they do exercise, but they do a very suboptimal routine. So they're doing things that are not muscle building. For example, many clients will come to me and say, well, I walk for exercise. Great, walking is great, but it's not resistance training. And I will say that with social media, there are good things and bad things, as we all know. But I feel like lately there's been a big push on social media for women, especially postmenopausal women, to start weight training, which is great for bone density, but leads to a lot of questions for me from these people about what can they do or what is safe for them to do. So I think our clients are becoming more interested in weight training, but they want to know how to do it in a safe way. So, how can we help people with scoliosis learn how to resistance train properly? Well, I think awareness is the first step. So, this is an example of a client that we worked with had already been working out in a group fitness class and wasn't realizing how much she was compensating or leaning into her curve during the class. So, the first thing that we worked on was how to create a neutral alignment that she could more consistently exercise in. And by doing that, she was able to do more with her workouts with less pain and be able to strengthen in a little bit more balanced position. Also, we want them to be aware of their condition. And I'm sure you do a lot of education with your patients, as we do as physical therapists, is what is modifiable and what is not modifiable. And what's interesting is that I'm seeing a lot of great results in terms of posture with these clients, balancing their musculature, improving their alignment. But they're always asking to see their x-ray improve. And I think you all are doing that a little bit with bracing, which I'm really excited about and to collaborate about. But I think in terms of the weight training, educating them in terms of what are we working on? We're working on getting you to the most neutral position that we can because we're seeing that the muscle imbalance is maybe irritating areas or causing compensations or giving more discomfort. So teaching them how to exercise more in that neutral position, getting them off what I call the Scoli coaster. And I described this a little bit before as to where somebody starts an exercise routine, then they have to stop it, they have to pull back, and they're always starting and stopping exercising. So, really, what we do is we teach them how to gradually progress over time, working in a neutral alignment. So, we teach them that if you're doing an exercise and you're seeing you're not able to maintain your alignment, you're really shifting into your curve, or you're really off balance with it, you might need to reduce the intensity. And I work with many clients who are CrossFitters or power lifters, and they need to really take a step back and build a stable foundation before they can go back into their routine. So, in terms of our warm-ups, I know that with Clear, you do use some warm-ups in terms of mobility for your clients before they do their home exercise program. This is some of what I use for warm-up, and some of this comes from Schroth and different schools of scoliosis exercise. But the idea is to start doing some gentle elongation of the spine. So depending on the age of the client, if they're a little bit younger, they might be able to tolerate a full hang. If they're a young adult or older, we might start doing it with feet supported just to reduce the amount of pull through the spine. Or we would work with our older adults to do the seated reach, where they're sitting and reaching up the wall to create elongation, or maybe even a rock back to start to create that elongation. So all of our clients have some sort of elongation work preparatory in their routine before they're starting their weight training routine. Another piece of their warm up is usually some sort of scoliosis exercise. So, this may be an exercise pulled from the Schroth method. Um, I use those as part of a warm up because they tend to be more not gravity. They're not against gravity, so they can be good for muscle activation, but we want to move our clients up into gravity as much as we can. And they may also do some exercises. For example, we use in CS to create an active self-correction and then do some sort of movement to start to prep the muscles for their routine. So I'll give an example of a client that I work with Tony, that she does her clear exercises as part of her warm up and then gets into her strength training routine. So it's a nice combination to be able to have that muscle activation and that get into that curve posture before you're going into your weight training. The way that we break down our weight training exercises is a little bit by their category. So we break them up between push and pull exercises, and they are also done in different movements. So we have pushing or pressing that is horizontal, which means straight away from the shoulders, as well as we have pushing or pulling that is vertical overhead for upper body. So basically, I break down these different types of exercises, and our clients may have a different mix of these exercises depending on what they're working on or what they're focusing on. So, in terms of horizontal pushing, this is typically what you would see as a push up or a bench press. So, some of our clients may start as simply as lying on their back, pressing weights from that position. Sometimes we will use propping. If you're familiar with the Schroth method, especially the Barcelona school, we use wedge propping to help to neutralize the curve as much as we can. Sometimes they don't, depending on the curve. And really, with any pressing activity, we're looking that they're able to maintain as much of a correction and alignment of their thoracic curve as they can. So I find that this tends to be a little bit more challenging to the thoracic curve, the upper body exercises. So we're teaching them to create some correction and then maintain that during their exercise. So in terms of the horizontal pressing, we're always working from the scapula away. So I will cue them to either create some activation around the scapula to stabilize. Especially with the push up, we teach them to pull the chest down to also activate the muscles around the back. And then, of course, depending whether they're hyper or hypokyphotic, we might change a little bit the cueing for them in these exercises. In terms of overhead pressing, this would be a vertical push or a vertical press. And I know that there's mixed feelings about putting weight overhead with scoliosis. Um, I've done it for many years with no issue, and I find that our clients can do it pretty well if they have enough range of motion of the shoulder. So where people tend to run into issues is maybe they don't have enough range of motion overhead, or maybe they have unequal range of motion overhead because of a thoracic curve or maybe a bigger thoracic prominence. So this is something that you might need to work on range of motion first. So that's something I might check, and I might do something like this pullover exercise on the bottom left of the screen where we're working on flexibility, getting an eccentric stretch of the lats to be able to work on that overhead motion. And then I may progress them into an overhead press from there. Now, if I find that, or if you find that your clients are having a lot of issues with overhead pressing, you could always give them an incline press where they're sitting on an incline bench and then press because it doesn't require as much range of motion, but they can still work and receive the benefits of the exercise for overall shoulder health there. In terms of pulling, we do horizontal pulling as well as vertical pulling. So horizontal pulling is pulling at the shoulder height, usually. And I like using this example like a bent over row here where I'm bracing on the treatment table because I can really work with the client to be able to determine are they maintaining a good alignment of their thoracic curve in terms of rotation. So I find when we're doing more single arm or single leg is where we want to pay attention a little bit more to rotation there. So this can be a really nice exercise or even sitting rowing with a band, just cueing to maintaining as much their neutral correction as they can. And then in vertical pulling, I really like this overhead pull down type exercise in a corrected position in potentially your C's. Active correction is really nice to engage them. They could progress this to maybe a lat pull down machine, but this can be a really nice exercise for them. And of course, again, with the pulling, it kind of depends. Are they hyper or hypokyphotic? Do we need to modify? I often find my clients who are very hypokyphotic, if they do too much pulling, squeezing the shoulder blades back, it becomes uncomfortable for them. It feels like they're pinching in the area. And this is an issue I run in with some of my colleagues in the physical therapy world who don't have scoliosis experience or don't have specific training. They just give the clients like 10 pulling exercises, and then they really don't have any instruction how to adjust for their scoliosis. So they end up coming to me with more pain or more uneven discomfort because they're just doing 1,000 pulling exercises. So there needs to be a balance, and there needs to also be some education on how to adjust for scoliosis. In terms of lower body, the squat is probably one of the most common push exercises that we use. Push is more of a quad dominant exercise for the lower body. When I'm looking at my client's squat, and this might just be a sit to stand from a chair, depending how strong they are, their starting point. Or this may be a weighted back squat if the person is at that level to be able to do that. I'm always looking at them from a side view and from a posterior view. From the side view, I'm looking at their ankle, knee, and hip range of motion. I'm looking at the angle of their torso to see, are they leaning forward a lot? Are they able to keep themselves pretty upright? I do find that our clients who've had spinal fusions, because they don't have as much flexibility, they're tending to lean forward a little bit more with their squats than our clients without spinal fusion. And sometimes that might be their baseline. Sometimes that might be something I need to work on with them. But if we work with clients that are fused all the way to their pelvis, that might be just what they're able to do with that fusion. In terms of head, neck, and shoulders, that the shoulders are even and that they're looking forward or slightly down. When I look from the posterior view, I'm looking to see, are they able to maintain their pelvis underneath them? One of the biggest compensations I see with squatting is the pelvis will shift out of alignment. So a lot of the work we do is to work on the pelvis alignment. And we even work on some single leg exercises I'll talk about later to be able to work on trying to help them center the pelvis positioned with their squat. We're checking for this butt wink. I know this was like a big like thing on social media at one point. If you have a butt wink, is it bad? But we're really looking to see, is it a flexibility issue? For example, my teens with scoliosis, some of them have really tight hamstrings. So the butt wink is happening because they're basically running out of hip range of motion to be able to get down in the squat, or maybe they have stiff ankles that can create a butt wink. Or some of my hypermobile scoliosis friends, they might start with so much lordosis that it looks like they're winking their butt at the bottom of the squat because they don't have the motor control. So it's a matter of differentiating what the issue is, if you're seeing something weird happening in your client's squat, and how to address it, whether you need to address flexibility or maybe control for that client. In terms of hinging, the most popular hinge is a deadlift. And we will work with our clients first to be very comfortable with hinging in their neutral posture before adding any resistance. So many of our clients don't even have the ability to separate hip hinging from back hinging. And I think that's where they run into a lot of issues when they just get thrown into this group class or with the personal trainer, because they have to understand that difference. So our clients may do more of this conventional style to the left, where they are hinging from the hips, maintaining a neutral position, or they might do something more like a sumo style with a wider stance. That at the bottom of the screen. I find that that tends to work better with people who have larger lumbar curves, more rotated curves, because it's hard for them to maintain the hinge position because of the rotation. So I do find they do better with the sumo style in that case. But I do like deadlifting for our clients, of course, if they're doing it in the proper form and with the proper progression. Of course, it has to be monitored in that way because many of them, if they're doing like any person, if you're doing the improper form, is where you may have an issue to an injury. So we really gradually build them up with this. And many of our clients have gone from deadlifting 5 pounds to 70, 80 pounds over a period of time. And it works really well for them because usually then they can lift their grandkid or they can feel more stable and not have as many issues with that. In terms of single leg exercises, we're looking at pelvis control, we're looking at stability. Can they rotate the hip on the pelvis and the pelvis on the hip? I find that many of these clients might have different hip range of motion side to side, or they might have their pelvis rotation that's hard for them to control. So, can they maintain that against a challenge like a split squat or something like that? So, many of our clients, we might just be teaching them how to stand on one leg without losing their pelvis stability, all the way up to our clients that are doing step ups or more challenging strength exercises on single leg. So, this is something that I think can be very helpful if you're incorporating single leg exercises with your clients at any level, that they can really learn how to control the alignment of their pelvis. In terms of rotation, many clients ask me, should they do any rotation exercises? I think that if we're doing some rotation movement unweighted, I know that there's some mixed feelings in the scoliosis practitioner world, depending on your school. Is that okay? Is that not okay? But I think that weighted inflection and weighted rotation are things that I tend to not encourage unless the client needs that for their sport. Can we achieve that in a way where we're not going to an end range rotation? Because as we know, when we're rotating one curve, are we then causing issues in another curve? Or are we someone who has a big instability in a lumbar curve that or they have pain, right? We might have to do some assessment. And I think there was a recent Delphi study looking at the overall consensus of fitness for adults with scoliosis and looking at risk factors in terms of how much coronal imbalance they have, how much sagittal imbalance they have, and what degree their curve is, if it's a lumbar or thoracolumbar curve. Those might be risk factors that we may want to keep them in a neutral posture for the majority of their exercises, and especially if they're incorporating weight training. So, of course, this is going to be individual, but if I'm talking to a general audience, like on social media, I tend to be a bit more conservative on this. And we could always have a discussion on it too. I'm always curious other people's approach as well. In terms of lumbar curves and lumbar stability, I find that really core pelvis, hip stability are key. Probably some of this you know. And watching for the pelvis alignment, especially single leg work. And I found some good results thinking about the connection from the lats to the glutes. They kind of create this X across the back, which I think can create a nice stability, especially in this lumbar type curve where we have the lumbar spine rotating in most cases left and the pelvis rotating right. There's almost this area where we have a transition point. And I found that really using the lats and the glutes to stabilize that transition point can work well for these clients. In terms of dynamic movements, um, my sport of weightlifting is a very dynamic movement. I'm going through different motions with the barbell in hand. It's really difficult. I'm not training the clients to work in correction for this, where what I'm looking at is, can they do accessory work or can they do stability work where they're maintaining good alignment outside of their routine? So often I work with CrossFitters and they're doing pull-ups, push-ups, power cleans, all kinds of exercises in one session. And really, I'm working with them to work on stability, work on form, and make sure that they're doing this in the best way for their individual curve. A lot of times for them, that's just managing fatigue because they are doing 1,000 reps of something or something ridiculous in that range. So, just a quick thought on working with clients that also have global kyphosis or sagittal plane issues. This client came to me on the left with this very much leaning into a kyphosis, even though her main curve was a lumbar curve. But what I found was that she had good flexibility. So we worked a lot on paraspinal strength, core strength, pelvis position, and this was her result after 3 months of training with us. So I think that we can do a lot for this population as well. And this person actually also had a lot of issues with bone density, low bone density, and was able to maintain her bone density by incorporating strength training after she was losing bone density year after year. So I think it's important to, as we all do, do the assessment to see how much of this is stiff, how much of this is flexible, and how can we strengthen this person in that best position possible. A quick comment on some more elite athletes you might work with. So this client I work with on the left is before she started training with us, and then on the right is after training with us. And one of the challenges is that she is a very high level wake surfer. She's the world champion in her category. And she had a lot of compensations that were just built into her curve. So we did a lot of work to be able to work in more neutral position. We use a lot of machine exercises so she can continue to build her strength as we reduce the intensity on some of the barbell work so that she can have good form with her exercises. And she also wears a brace at nighttime to also help with her curve, but it can be challenging when clients already have really strong patterns built into their scoliosis to kind of push them out of it. And that was kind of when I was introduced to Schroth method, I was kind of a bit full of myself from being in weightlifting, saying this is going to be easy, and learned a lot about how much I was compensating with my curve for my weight training by doing the training. In terms of postoperative clients, I've worked a lot with this population. One of my first jobs out of PT school was working in the scoliosis surgery unit. So we work with a lot of clients who have had spinal fusions, and I wish I could give a formula for it, but it's so individual depending where their fusion is, how well their fusion was done, what their result is. Does their fusion include their lumbar spine? So all of this is going to factor into what they're doing with their exercises. So often they tend to do a little bit better with the sumo style deadlift, with that wider stance. They might need modifications for overhead movements if they have a thoracic fusion, and they may have a residual curve. And often we treat that residual curve just as a scoliosis curve itself. So adding some symmetrical work, some asymmetrical work, or even some stabilization work on that in that curve. We work with many clients who have had fusions and then want to get back to fitness. So teaching them what is safe, how to modify, and things like that. So in terms of how we put this together into an exercise routine, often we're breaking it up into the different categories. So those horizontal push, horizontal pull, vertical pull, and then the lower body work as well as the accessory. And we're creating a routine that's going to match what that client really needs to focus on. So generally, I tend to have a sprinkling of all of this in our client's routine, but it depends on their goals as well. Some of our clients have more vanity goals with the biceps, triceps, or they want to do bodybuilding, whatever, but we'll build their routine with these foundational movements and incorporating that into their scoliosis posture as well. In terms of core training, I tend to do most of our core training in neutral, but we approach it from many different positions. So we use anti-flexion, which is meaning they put a weight out in front of them that would maybe cause them to round, and they're working against that. Anti-extension, which would be against arching their back. Anti-side bend would be something like a farmer's carry where they're holding a weight in one hand and walking. I like that one a lot because they can really work on maintaining their correction as they're walking. And it translates really well to like carrying groceries and carrying things from the car. So it can be a really nice option. And then anti-rotation using like a Palloff press or something where they're working against a rotation force, but they're not necessarily rotating into that force. Of course, with pain, we teach them how to modify. We teach them if they are in a pain flare or if they're having a painful episode, how to adjust their workout routine. And this is important because many of them will just stop exercising at this point. So we teach them, okay, maybe you can do exercises that don't work that area where you're more flared up, or maybe you can use the scale to determine which exercises to focus on during that time. So this can be a really nice option for that. In terms of how we work with our clients, we work with pretty much the majority of our clients virtually remotely. So we bring them on Zoom and we do a curve specific assessment. So we analyze their curve, whether we have photos or we have an X-ray, we classify their curve. We do a functional movement assessment, what we can do on Zoom. So we're looking at squatting, hinging, single leg balance, and other things that are going to be important to developing their exercise routine. And then we do a lifestyle assessment to see how are they impacting in nutrition, sleep, stress management, and we start to educate them on their curve as well as start to teach them some of their active self-correction so that they can start to integrate that into their workout right away. We deliver their workout routines through our app so they can do their workouts at home or in the gym. And we incorporate their other exercises. So if they're working with a clear practitioner and they have other exercises that they're doing, we incorporate it into that routine for them. And then of course we consistently progress them over time. And our clients actually have the option of uploading videos to us so that we can check their form and make sure they're doing the exercises properly. And many of them take advantage of this because they are happy to get that feedback and they feel more confident they're doing the exercises properly. And then we teach them how to progress over time for their long-term success. So we really work on trying to build their um, confidence with their correction, how to build strength over time, and really how to build habits for the long term. So many of our clients, even after they finish working with us, they too continue working out, which we feel is very important that they have those tools for the long term so that they can continue to exercise in a way that's considering their curve. So this client gave me permission to share her picture. She had very phenomenal results working with Tony in bracing, as well as I believe she did a camp with Tony before she started working with us. And one of her goals working with us was she wanted to work on strength training, but she wasn't sure how to integrate it. So during the time we worked together, she was still bracing a few hours per day. We added some of the scoliosis specific exercises as well as a strength training, and we helped her with consistency in her exercise routine. She was having a lot of challenge because she has two children to manage being a parent, doing her work, and having two children. So having the routine built into her phone where she could just access the exercises, open up the app, not only was she doing her strength training, but it was also giving her the reminders to do her clear exercises as well. So she did really well. This was her outcome after, I believe it was about 6 months in the program. Compared to when she started, she was able to continue to improve her posture from where she was doing, and she continued to do her clear exercises and her bracing through the program. Um, just a word about this, like being someone with scoliosis, it's really important to me that people with scoliosis know that they have options, they have things that they can control, and it's never too late to start. These are some of our clients who have seen some great results in terms of skiing and doing things that they weren't able to do before by being able to build up their strength. So even if you're not necessarily referring our clients to, referring clients to us, just encouraging them to improve their strength, maintain their activity is so important for the long term. And I'm sure we're all doing that. I just want to emphasize because it is really, really important to me that people with scoliosis have those options to stay active. So if you want to potentially, this is me competing. This is me competing about a year ago, so I still do compete. I'm considered a masters athlete now, which I don't know how to feel about it because I feel old now. But here is all of our contact. If you do have a client that you would like to refer to us or you want to collaborate with us, we would so love to. This is our Instagram, our Facebook group, as well as our office email. So if you do have a client you want to connect with us or have a meeting with us, we are so open to any collaboration and we would love to help your clients if they need more help getting to their fitness goals. So I will open up for questions.
Yeah, I got a question for sure. If I don't know if it can be heard or not.
I hear you, Tony.
Oh, perfect, perfect. Well, I got a question about two things. One,
Yes,
the deconditioning in older adult patients, like we see that a lot, and in fact, the increase of seeing older patients has skyrocketed in the last like 3 or 4 years. If
yes.
if we were to give someone one conditioning exercise for just an overall conditioning of the entire body, um, what would you choose?
I would choose something that's multi-joint. I mean, probably one that's going to be super functional is a squat.
Squat. Yeah.
Squat, multi-joint. It's something they can do easily at home. I do find with our clients though, where they're having deconditioning is usually lumbar, is their paraspinals and their multifidus. So
Yeah.
even if I could say a second option would be something that is a hinging where they can start to activate those muscles as well. Yeah.
Okay. And question two is the butt link.
Yeah.
Is there any relationship between that and pelvic incidence?
I think yes. I'm not sure we have research to it, but yes, that's a good point because if you have someone with a higher pelvic incidence, they're going to have usually a higher lordosis. Someone with a lower pelvic incidence is probably going to be more likely to have that like structural butt wink where their pelvis is already a bit tucked under. Whereas the person who has more lordosis, usually I see them doing more the functional one, where they're not maintaining, they have either too much lordosis starting out or they're not maintaining it into the bottom of the squat.
Yeah, makes sense. Okay,
Yeah.
perfect. That's what I have. Thank you.
Yeah. Good questions.
Okay, Dr. Chung has a question. If you want to unmute yourself and ask her, go ahead.
I'm just wondering if your clinic is the only clinic that focuses on scoliosis PT, or if you have other docs you've chained through the country. Like, can we find a website somewhere where we could plug in our zip code and find someone near us?
Yeah, so this specifically related to like scoliosis physical therapy and weight training, we're one of the only ones that do that. But if you're looking for a scoliosis PT, there are many directories that you can look for. So there is a directory of the Schroff Barcelona school. So anyone trained in that school. There's also a directory called Schroff PTs in the US.com that has a directory of other scoliosis physical therapists. So if you're looking to collaborate with another scoliosis physical therapist, you can probably look there to find
Okay.
someone.
Okay.
Yeah.
I've just found in general, sending clients to PT, they have very limited knowledge with scoliosis and biomechanics and things like that. So I didn't know if there was specifically somewhere we could look. So thank you.
Yeah, yeah. Truthfully, the training of a physical therapist for scoliosis is in general, physical therapist is virtually nothing. I think we had like 1 day of training in PT school at my school. So somebody who's trained in the Schroff method or CS will have done additional training, and the person I would refer to. I usually don't refer to a general PT for my clients with scoliosis let's say if I can't work with them or something, I would only refer them to someone who has that additional training. Because, like you said, most general physical therapists don't have the specific understanding to be able to give them the proper exercise routine.
Hey,
Thank you.
Dr. Justin has a question. If anybody else has a question, let me know in the chat and I will call on you in order. But Dr. Justin, go ahead.
Yeah.
Yeah, this is great information. Thank you so much for being here today. It's just full of great information. I'm so happy that you could do some of this and really excited that you can do it online as well. I take care of some crazy, crazy athletes, kind of like yourself, some USA team athletes with scoliosis and stuff, and this would be great to add in. My question though is like, we do the virtual assessments and what are the check-ins and kind of what are the time commitments that you're looking for?
Yeah, absolutely. So we do a lot of checking in through our app. Like I said, we allow them to upload videos of themselves doing their exercises, as well as they do get Zoom check-ins with me. Usually, it kind of depends on the client how often they need those. Some clients check in with me once a month on Zoom. Some check in a little bit more frequently, like our teens. I check in with them usually once a week. And then in terms of the commitment, it depends. Usually we start with either a 3 or a 6 month program. And that is because I found that's kind of the time that they need to be able to really build that foundation. If there's someone who's totally new to exercising, then definitely 6 months. If they're a more elite athlete or if they're, if they can pick up things pretty quickly, then maybe starting with 3 months could be a good option for them.
Excellent, thank you.
Yeah. In terms of, oh, and in terms of the time commitment to the exercise routine, I build the routine based on their availability. So I build the exercise routine based on what I know they will actually do. And that's a big part of it because we found that if we give them 10,000 exercises, they're not going to do it. So some of our clients work out like 15 minutes a day, some work an hour training sessions, etc.
It looks like you can pretty much do a lot of this at home. You don't necessarily have to have gym equipment if you don't want to.
Correct. Many of our clients work out at home, like Dr. Tony was saying, like some of them are even afraid of the gym environment because they don't feel comfortable. Maybe they're self-conscious. So, yeah, we have a good majority of clients that work out at home with weights, dumbbells, resistance bands, and some that do actually go into the gym.
Okay, Dr. Alex.
Sorry, I had to unmute. Hold on for just a second. First of all, thanks for being here, Beth. I appreciate it. I do have a bunch of questions, so the Inquisition begins.
Go
So,
for it.
I think it's great, and I'm really curious as to if I want to transition a patient from my care and have them work with you. I like to give them a little bit of information about yourself, like this presentation that you gave. Do you have anything like this that I could give to a patient to show, or any information that I could say, hey, here's an overview of something I think I'd like you to continue with? Do you have something like that that I can give to a patient?
Yeah, absolutely. So we have a lot of information on our website. So I can send you either the descriptions of how we work with clients on our website, as well as I can even make up a flyer if you feel like that's might be helpful for your clinic that you could hand out to them, and it would just have like a QR code for them to contact us.
Yeah, anything that you can make the transition easier, because I know I get this question a lot as to what else I can do, right? So that's always the transition, and it's really hard to refer to anybody because again, there are not a lot of scoliosis specific people. So anything that you think of, like I would really appreciate it because I think that would be something that I know I could, cross refer back and forth with you, and I think that would benefit
Yes.
both of us.
Yes.
My next question is, it appears that you're dealing with primarily an adult population as opposed to an adolescent population. Do you do adolescents as well? And what is your experience in how they respond?
Yes. So we do work with adolescents as well. It is a smaller group of our population. We usually work with adolescents that are, the parents have come to us because the teen is maybe playing a sport that they're doing some sort of strength and conditioning and they want guidance on. So, for example, like one of our teen clients just went to the national championships for gymnastics. But also we work with teens that are very sedentary and the parents just like they'll only do this at home. So this is my only option. Um, we have
What's that?
seen, oh,
Did you see a
sorry.
text from Natalia?
A
Uh,
text. I'm in a
somebody's okay, there we go. Um, in terms of our teens, usually our teens are being braced. So of course, a piece of that is like also the brace aspect of it. For those teens, we may incorporate a little bit more on the scoliosis specific side than the weight training, but it kind of depends where they're at. We've seen pretty good results in terms of maintaining curves, and also reducing curves in I would say it depends. You know what the challenge is too, as you were saying, Alex, is like it's hard to find the right orthotist. So sometimes they're coming to me with the brace and the brace isn't appropriate and they're in Wyoming. I don't have an option to do, to get them a better brace, et cetera. But yeah, we've seen some pretty good results with teens as well.
Okay, everything that you did initially is a functional pattern-based training. It's all basic CrossFit, which Olympic lifting, which then you have translated to, okay, a little bit more scoliosis specific. Do you address like goals with the patient and say, hey, I'm just trying to get you to move better? Or are you doing, posture work? Like, how do you address that? And what is your communication with that patient when you assess them?
Yes. So each of our patients, before they start working with us, they set a set of 3 month, 6 month, and 1 year goals. So depending on what their goals are, then we tailor the routine for them. So I would say we have goals that are related to aesthetics. So we have many clients who they want their curve to look more even. We have goals, of course, related to pain management. We have goals related to posture. And we really focus on reassessing those as we go. So we check in with them definitely at 3 months, definitely at 6 months to see how they're progressing towards those goals. Um, yeah, so the program might be different depending on which goal that they really want to work towards.
Okay, and then fees, like what's your average fee or what do you say? Just because I know I'm going to get asked the question, do you know what they charge?
Yeah. Yeah. So our one-on-one coaching is a monthly fee. We include everything that I discussed, like all of their assessments, their check-ins, things like that. So that program is $400 per month. If they're looking for something that is in a more budget-friendly range, we run a group program. Our group program is a bit more general. So it's not as individualized to each person, but they do get the opportunity to get modifications based on their curve. So they're following a little bit more of a template program that they can self-adjust and reach out to us for help. So our group coaching is our more affordable option. If you know that someone's a little bit more price sensitive, then they might be a better fit for the group coaching.
Yeah, I'd rather just give them your information, but and then they can decide after they meet you. But I
Right.
like to have a ballpark so I can have that
Yes.
conversation. And then lastly, is it safe to basically introduce you as, hey, this person does strength flexibility training specific to scoliosis and is versed in that? Like, how would you like that introduction to be made?
Yeah, absolutely. So if you want there's a few ways that we collaborate with people. One is that you could introduce us on a group email just to
Mhm.
say like, hey, I'm referring this client. What we'll do is we'll set up a meeting with them just to make sure that they're a good fit and to kind of direct them into which program we think is going to be the right next step for them.
Okay.
Yeah,
So
but you
email
could,
is your preferred method of contact.
yeah, email is good. I can give you our office number as well. But yeah, email is probably going to be best because then you and I can also communicate about their like if there's anything I need to know about their care that you're giving them as well.
Okay. All right. I
Yeah.
really appreciate you taking the time to be here. Thank you.
Yeah, you're welcome.
Dr. Chung, you got more questions?
Just a couple quick ones. Just to piggyback on what you said, group training, does that mean you offer like Zoom type consultations or?
Yes, yes.
Okay.
So we actually work with the majority of our clients on Zoom and through our app. So we work with people all over the country and all over the world. So we have clients from US all the way to Australia. So if you have clients that are local to you that maybe can't find a scoliosis specific option nearby them, potentially they could work with us online.
Okay. And then secondly, are the things that you do all based on exercise, or do you use any other modalities like ultrasound, TENS, I don't know, just injections, or is it just simply exercise?
So for this program is basically exercise because we're working with them completely remotely. I do work with clients in person sometimes. In person, I may use some hands-on techniques. I may use cupping. Um, I don't use a ton of ultrasound tens, things like that. I don't really have access to it in my clinic. And I find that they do well having the exercise that they can also do at home. So I would say those are probably the modalities that I use the most.
Okay, thank you.
No problem.
Okay, doesn't look like we have any other questions. Um,
Perfect. I'm here, Heather. I want to say a little thing, and then I'll let you close it out. Just wanted to thank everybody for coming on. Of course, thank you, Beth, for coming. I think this is a huge a thing. I know for me, every patient asks me about exercise and scoliosis, and it's not like I don't want to help them. I just don't got the time, right? It's just not my thing. Where I'm too busy taking care of the all the clinical aspects. So I love sending somebody to somebody like Beth who can give them the strength training that I don't have the time to prepare for them, but she does, and it's what she does, and she's going to account for their scoliosis, which is crazy, amazing. I mean, just amazing value. So thank you. Heather wants to she's going to close us out, give us a little update on upcoming webinars. And again, thank you for coming. I really appreciate it. Go ahead, Heather.
all right. Our next webinar is going to be Friday, August 8th at 1 p.m. Eastern, and we will be joined by Amy Dixon of Inner Strength Pilates, and she will be discussing Pilates for scoliosis patients. And of course, we have our in-person fall symposium in Celebration, Florida, October 3rd and 4th. And you can sign up for both of those events on our Eventbrite page, and more emails will be coming out with links to those as well. So thank you again for coming. Thank you, Dr. Beth. That was fascinating. And we hope to see you all at the next webinar.
Thank you. Have a good rest of
Thank
your
you.
day.
You too.
Bye-bye.